Wellness Incentive Program. Smoking Cessation by Africa, Lindsay, and Samreen. Smoking Cessation Program. Cessation Goals. Occupational health and safety amplify resources and activities that support people in quitting tobacco. OSH activities align with three overarching goals. Develop and share tailored and/or targeted cessation resources, increase the reach of cessation interventions and the use of cessation treatments among high prevalence populations, improve engagement with health system in order to advance the integration of cessation-related clinical care. Objectives. We have 5 objectives. Number 1, protect the health of employees who are the asset of the company. 2, prevent occupation-related diseases. 3, curb spending, increase medical spending of the Health Insurance Society. 4, aim of reducing costs attributable to smoking. 5, take the initiative in fulfilling social responsibility in order to protect environment. Why cessation is important? Tobacco use is the leading cause of preventable disease, disability, and death. While quitting may be difficult for some, it is possible. Cessation, a key component of a comprehensive approach to prevent and reduce tobacco use. Cessation is one of 4 impact areas that serve as foundational pillars of smoking and health work. Smoking shortens a smoker's life by 10 to 14 years. If they stop before age 40, smokers reduce their risk of dying from smoking-related diseases by 90%. Illnesses, conditions associated with smoking. Smoking increases the chances of developing 50 different diseases. Number 1 cause of preventable death in the world. Tobacco users are at a higher risk of asthma, bleeding in the brain, breathing problems, cancer, diabetes, heart attack, high blood pressure, infections, nerve damage, stroke, tooth loss, and more. Program design and development. Design is for food manufacturing company. In the smoking area, smoking is not allowed in the workplace but permitted outside the work area. There are active and passive smokers, affecting health conditions and decision-making power. The WELL Steps Engagement Model. Maximize wellness engagement. Effective marketing, wellness committee, small incentive swag, leadership support, communication channel, benefits-based incentives. Design. Pre-contemplation, contemplation, preparation, action, HRA. HRA means health reimbursement arrangement, biometric screening, coaching, wearables, challenges, campaigns, competitions, presentations, classes, and maintenance, maintaining healthy behaviors. That is the WELL model. Awareness literature, counseling, nicotine gum alternative availability, fitness check, seminars on the wellness program, cessation insurance coverage, helpline, surveys. Targets, tailored and targeted cessation resource, addressing high prevalence populations, health systems, clinical improvement. Focus. There are 6 main reasons for employers to support smoking cessation in the workplace. 1, improve employee health. 2, increase productivity. 3, reduce cost. 4, enhance job satisfaction. 5, effective setting. And number 6, better corporate image. Implementation. Quit smoking. Awareness literature. Printable pamphlets in lunchroom and offices. Warning and health risks on notice board in smoking areas. Informational videos. Sharing success stories, how to quit smoking. Counseling. Monthly supervisors meeting. Awareness sessions with young age employees. Joint Health and Safety Committee members should be available for counseling session. Sharing links of motivational speaker, example, TED Talk. Fitness check. Mostly, people are hired through agency. Employees are hired by taking their physical examination. This program includes lifting, pushing, pulling, and coordination of hands. The test also checks the heartbeat rate. Helpful to get to know the physical and heart conditions. Cessation insurance coverage. The Ontario Drug Benefit Program provides reimbursement. Drugs, if you are age 18 years or older. Treatment for each is limited to 12 weeks. STOP program. Ontarians can access limited NRT. NRT means nicotine replacement therapy through workshop hosted across the province. Helpline. Eligibility to receive free nicotine replacement therapy. Call 905-358-5552. For information on quitting smoking, the law or secondhand smoke, email the tobacco hotline or call 905-688-8248, extension 7393 or 1-888-505-6074, extension 7393. The Ontario Drug Benefit includes coverage to help you quit smoking. Supervisors and Joint Health and Safety Committee members are also available if someone don't want to show up. Their identity number for contact available on notice board of a company. Counseling and support groups by government. Talk to your doctor about getting individual counseling or joining a support group. You can also contact your local public health unit. Visit Help 811 online or call 811. Visit the Smokers Helpline website. Incentive.
No, it's my turn.
Okay, it's Lindsay's turn.
Okay. For the incentive for employees, as they progress and have more and more success, they build points and earn a larger benefit-based incentives such as a discount on their insurance premium or lower copay or deductible. The small short-term incentives provide immediate rewards for wellness program participation, such as completing a personal health assessment, biometric screen, or a behavior change campaign. The best way to do this is to start with motivators, short-term small incentives like gift cards or t-shirts. Surveys. Using health and productivity, surveys on an ongoing basis can begin to evaluate the return on investment of offering tobacco use cessation programs on employee absence or productivity. The surveys may be proprietary and may require a modest fee to use. Two examples are provided below. Health and Work Performance Questionnaire, Work Limitations Questionnaire. Survey conducted by JHSC to collect data. Monitoring. Metrics for worker productivity, healthcare costs, health outcomes, and Organization change allow measurement of the beginning, baseline, middle process, and results of workplace health program. In general, data from the previous 12 months will provide sufficient baseline information and can be used in establishing the program goals, objectives in the planning phase, and assessing progress toward goals in an evaluation phase. Worker productivity. Reassess the average number of the sick days per employee at the first follow-up evaluation. Process periodic repeats of other baseline measurements. Healthcare cost. The process. Changes in healthcare use and cost from baseline. Assess changes in the number of employees who utilize tobacco use treatment services, if provided through health benefits. Compare healthcare use and cost of participants in programs for tobacco cessation before education and other programs are initiated and after operation of these programs. Tobacco smoking increases the risk of heart attacks, strokes, lung cancer deaths, and other serious health outcomes. These are the end stage results of smoking, and measurable differences may not be seen for several years. For this reason, it is important to measure earlier outcomes such as the number of employees who quit smoking or decreased in sick days. Health outcome. Assess changes in employee levels of tobacco use such as number 1, changes in the number of employees reporting tobacco use or exposure to secondhand smoke before and after the tobacco cessation campaign or program. 2, changes in the frequency or duration of employee exposure to secondhand smoke. 3, increase in number of employees who remain tobacco-free for 6 or more months. 4, increases in the number of quit attempts made by employees. Organizational outcome. Document steps taken and progress toward implementing each intervention selected. List numeric goals in each form of intervention which within a designated time period. Example, 12 months from startup. Employee reach. Example, number of educational pamphlets distributed. Employee participation. Example, number of desired participants in tobacco cessation classes are using state-based or self-contracted quit lines. Describe timeline for employment of each planned intervention. Example, length of the time and timing of tasks to develop, initiate, and conduct a mass campaign. Create a baseline budget for new interventions, including classes instruction, classroom space, materials, etc. Identify opportunities for new partnership with community groups who provide tobacco cessation programs. Example, the American Career Cancer Society, local health department, local hospital, etc. Reassess employee satisfaction regarding working supported tobacco cessation program.
Okay, now I'll take it.
Okay.
Non-tax employee counseling services. Employing counseling services are not taxable if they are one of the following: an employee re-employment, an employee retirement, an employee mental or physical health, such as counseling for tobacco, drug or alcohol abuse, stress management, or employee assistance program, or that of a person related to an employee. Cost analysis. To calculate the ROI, ask how much money was saved or earned after the program was implemented for every dollar spent on an employee. May not be able to put a momentary figure on the result achieved, because over here we are doing it like it's not a proper program. It's like we are helping them to quit the smoking, right? So it is a voluntarily we are helping them. So that is why we cannot take a exact amount that how much we are spending and how much we will return on that investment right? So we will take over here the value on the investment. That is an approach measure whether the non-financial metric increased after the program was implemented. So value on investment mean it increased the productivity, it involves the engagement of the employees, healthcare spending, employee turnover and high retention rates, talent acquisition, and health merits. So for here, we have made a cost consumption program, that is the charges we have made, that is like assumption for us, but still health risk assessment offered through benefit providers. The insurance, the company is providing the insurance to all of the employed that are hired. Biometric screening clinics. Uh, in this, we have shown that the company usually hire the people through agency, and when they are good at work and they are done with their training, then they go for their hiring. So when they are hired, then they will go through all this process. Otherwise, there's no spending over here. So second one, an incentive for participation. So we are giving, if somebody is willing to participate, so we will provide them a $20 gift card or a t-shirt. Smoking cessation program, coaching and counseling by phone, $75 per participant enrollment. Over here, we also taking the cost to minimize it. So we are like per participant enrollment. We are not taking the all of the that are the participant, but those who are willing to do it, right? On-site smoking cessation smoke group. So this is like in the free time or when they're in the lunchroom or something like that, or they're sitting in a their smoking area at that moment. From the joint health and safety committee or the supervisor will be there and will start sharing their how to quit the smoking. Policy changes, smoke-free workplaces, flexible work arrangements, right? So this is also not costing us anything. Smoking area outside the work premises, it will cost us $5,000 because we need benching, heating, decoration, arrangements, and these types of things. Campaign, a communication campaign, pamphlets, intranet, newsletter, and other supporting literature. Intranet over there are we are assuming a company, and mostly the companies have the TV, large screens, these types of things in the lunchroom and different working areas. So intranet and newsletter, this all will cost us $2,500 per annum. Physical check and physical exam, this is also outsourced, and this is only required for the new hiring. Administration cost, that will cost us 5,000 because from the joint and health committee and the supervisor and anybody that are supporting them, we have to give them. So overall, we have put a cost of 55,000 for to run this program. Cost per employee per year statistic, Canada stated that yearly employee absentees rate range from 4.7 days to 11.2 days. This is a significant reduction. In the fact, it translated into the estimated saving of 251 per employee each year. Wellness program helped reduce the absentees by between 1.5 to 1.7 days per employee each year. Okay, if any questions? Thank you.